A1C is a laboratory test or a blood test that we can use that will monitor a blood sugar's average level over a 3-month period of time. So the hemoglobin A1C is very important in that it tells us how well your blood sugar is controlled. We know that it doesn't eliminate the need for finger sticks at all, but it fills in the gaps in between those finger sticks and tells us how your blood sugar is in the interim. So determining a hemoglobin A1C is a simple blood test. You present to your primary care physician, your primary care provider, they order a blood test, you go down to the lab, they draw blood, and we get the results. The incidence or the frequency of determining hemoglobin A1C depends on how well your blood sugar is controlled. In patients that have very good blood sugar control, it can be as infrequent as a couple times a year. In patients that are trying to maintain better control, we'll probably want to get a hemoglobin A1C about every 3 months. There are different targets for the hemoglobin A1C depending on the organization making the recommendation. We know universally the target is a hemoglobin A1C of less than 7. The National Endocrine Society, though, recommends if we can get that level down to less than 6.5, that's where we want to be. The reason for that is there was a study called the UK PDS study that showed that if we can get that hemoglobin A1C down less than 6.5, we can almost eliminate end organ damage from diabetes. So diabetes plays havoc on multiple organs in the body. We know that diabetes is the #1 cause of diabetic retinopathy, which results in blindness. It's the #1 cause of blindness in patients aged between 20 and 74 in the United States. It is the #1 cause of end-stage renal disease, resulting in dialysis. We know that 60 to 70% of patients who have diabetes are going to have some form of nerve injury from that diabetes, which means pain or loss of sensation in their hands or problems with their digestive system or other organ systems. We know that diabetes is a leading cause, or at least a contributing cause, to amputations in the United States. So it's an important role. We also know that having diabetes increases your risk of a heart attack or stroke by 2 to 4 times, according to the CDC. Diabetes is a disease of abnormal blood sugar metabolism that affects about 29 million Americans. That's about 1 in every 11 people in the United States. And it's estimated that about 3 times that amount, or 86 million, other Americans are at risk of developing diabetes. And unfortunately, it's a risk that's increasing worldwide. Diabetes has a direct correlation with weight or obesity. So as obesity increases, the incidence of diabetes increases. So differences that we can make in diabetes: we can regulate our weight, maintain a normal body weight, we can eat healthy, we can exercise. So some symptoms of diabetes: in some patients they may have, if their blood sugars are very high, the kidneys will try to kick in and try to get rid of blood sugar. So by doing that, when they get rid of sugar, what will happen is it'll also get rid of water. So patients will be very thirsty, and so they'll pee a lot. So they'll have polydipsia and polyuria. So they'll be drinking a lot, and they'll also be urinating a lot. Patients who are at risk of diabetes won't have any symptoms at all. So that's the importance of getting tested. The key to diabetes is control. If we can control the blood sugars, then we can control the adverse events associated with diabetes. We know that any adult over the age of 45 is at risk of developing diabetes, so they all should be tested. We also know that patients who are obese or overweight and have one additional risk factor are also at risk of diabetes and should be tested at a frequency of at least every 3 years. Those additional risk factors include physical inactivity, a family history of diabetes, anyone who's non-Caucasian, women who have had a baby of greater than 9 pounds, or had a history of gestational diabetes, or have been diagnosed with polycystic ovary disease. We also know anyone with hypertension, a low HDL cholesterol, clinical conditions associated with insulin resistance, or anyone with a history of coronary vascular disease. If you fit into any of these categories, please get tested. Don't underestimate the seriousness of this disease. So when we have diabetes, there's typically a comprehensive treatment program that's designed to individually for that patient. Unless we can control it with diet and exercise, it will likely involve medications. Treatment of diabetes may involve the consultation of a nutritionist and even a program designed to initiate exercise and maintain an exercise program. Unfortunately, even with the hemoglobin A1C test, we still need to monitor blood sugars in between values. There's importance to all the measures. The hemoglobin A1C will fill in the gaps between those individual blood sugar measurements. The individual measurements, though, are important in titrating your blood sugar control and can be important in which medications we would choose to regulate diabetes. Present recommendations are to monitor anyone who has diabetes on a regular basis. This means as infrequent as a couple of times per year in those patients who have excellently controlled diabetes to every 3 months to those who are working on better control.